We have Manshadi joining us from Manshadi's Pharmacy. It's great to have you back on the show.
Thank you, Susan, for having me.
You're very welcome. And as we were just discussing in the last segment, it is Heart and Stroke Month, being February. So we are making that our topic today, especially because you have witnessed someone having a heart attack in your pharmacy. That's
right.
Crazy.
That's right. So I'd like to quickly, if it's possible, talk about the signs and symptoms of heart attack. If we can put it on TV, that would be great. So please be aware of chest discomfort, but this discomfort can be in any area of the upper body, and people, they show signs of perhaps sweating, nausea, vomiting, fainting, and those are some of the things that you need to be aware of, and reach help 911 as soon as possible. We also recommend if you think you're having a heart attack, maybe have a couple of aspirin, baby aspirin, or one regular 325 milligram of aspirin, chew it. And of course, if you're taking nitroglycerin sprays, use it right away, the way you have been always using it, and phone 911 and get to the hospital as soon as possible.
These signs and symptoms that we just had up on the board, though, I mean, they could be indicative of many different ailments. And so perhaps, is it confusing to people sometimes? Like, am I having a heart attack, or am I just having a bad day? You
That's
know what
right.
I mean?
It is very confusing. However, any pain that comes toward the arms, left side of the body, if you have perhaps heart disease, diabetes, high blood pressure, those are some of the things that you need to be aware that it can be, it can cause heart attack, and you have a greater chance of a heart attack.
Okay.
So read about those signs, be aware of it, and so you can deal with it.
We don't have a board to look at for the signs and symptoms of stroke, but we're going to go over those as well.
Sure. With the stroke, maybe we can remember FAST, F-A-S-T.
Okay.
F stands for facial dropping, maybe one side of the face drops. A stands for arms. Is both arms working? And that's very important. And S stands for speech. Is it a slurred speech? And time, and T stands for time. That means we need to get these individuals right away to the hospital to give them a proper medication. So remember FAST and act upon them.
Okay. We have about a minute left. I know you also want to touch on antacids.
Yes. There's a lot of people have been asking us about proton pump inhibitors, such as Losec, Prevacid. There's a great number of Canadians are on those kind of medications. They should reach to their doctors and see if they're candidate to come off of it, or going to another group of drug called histamine blockers, such as Zantac and cimetidine and so forth. So they do not get the side effects of the proton pump inhibitors. I mean, proton pump inhibitors are good medications, but it should be only used if it is possible short-term therapy, and not for a long-term therapy. And unfortunately, people are been using this and not changing their diets, not doing the things that they are supposed to do, and they just take this antacid and
as a band-aid, and
as a band-aid, and they eat whatever they want to do and so forth. So please contact your doctors and see what we can do, because this is causing some problem. And if you have a question or concern, please contact your pharmacist, your doctor, and see how we can bring you maybe down to different type of drugs, or we can take you off this medication. Plant-based diets are awesome for this individual. A lot of water, sometimes even things such as probiotics will work. Anyway, there's lots that we can talk about it. And if you have questions regarding proton pump inhibitors, please don't hesitate to contact us so we can talk about it.
Fantastic. We are out of time, Misa. Always a pleasure to have you on the show.
Pleasure is mine.
Fantastic. Information on the screen if you would like to get a hold of Misa at either location.